New research released this week has revealed that last year, almost 20,000 more people died in Australia than expected. It is the highest number of excess deaths since World War II. Joining us live is Dr. Paul Griffin, Director of Infectious Diseases at Mater Health. Dr. Griffin, appreciate your time. Thank you. So do we put the bulk of those extra deaths down to COVID?
Yeah, look, it looks like at least half of those are directly linked to COVID, and a significant proportion are likely indirectly linked to COVID. So it's really clear it's had a huge impact on our mortality, particularly over the last 12 months or so. And we do need to do more to make sure that trend doesn't continue.
Well, looking at what might happen this year, what is your expectation about future COVID waves? When should we be bracing ourselves for another spike in cases, do you think?
Look, the only thing we know about this virus is it's completely unpredictable. I think what's clear is it's not going to go away by itself, and we do have amazing tools to combat it in terms of updated vaccines, excellent antivirals, for example, and we need to use those more to reduce the mortality and the impact of this virus in general. So, we know the virus isn't going to go away between waves, and our commentary does decline, so a lot of people get quite complacent after a wave is finished, and we do know that more waves will come. We just don't know when or which subvariant will cause them or how bad they'll be, and that's why we need people to be protected. We need as many people as possible to take up that expanded eligibility of an additional booster that's been in effect since the 20th of February.
So, Paul, are we still seeing new variants regularly coming through from overseas? Has the Northern Hemisphere winter given us any hints about what our winter will look like, both on the COVID and also, for that matter, the flu front as well?
It's hard to know. There's a large number of subvariants that are circulating. We haven't seen any new really concerning ones in the last few weeks, but the virus will continue to evolve. So there will be some more that will come. And that's why it's great that we've got those updated vaccines that are just a little bit of a better fit to the current subvariants than our previous vaccines were. And in terms of what happens with the flu season, there's a lot of discussion that it might be an early season, a little bit like last year. But again, we just simply can't predict with any certainty. But what we do know is that the flu vaccine also works very well, particularly at minimising severe disease. And so I'd encourage people to go and get that vaccine in the coming weeks when that first becomes available as well.
Okay, on the COVID vaccines, are we generally keeping up with the recommended schedule, or have a lot of us just lost interest, do you think?
Yeah, we're really falling away. I mean, for a large number of reasons, we did relatively well at the first and second doses, but then the booster uptake has really fallen away to the point where, in terms of people being fully up to date, that's probably sitting in the sort of 40% range, which just isn't enough as we know what this virus can do, and we continue to see those impacts. So, it'd be great if people could, go out and take up the opportunity to get another booster now that the eligibility is expanded once again, and we have improved vaccines, particularly the bivalent vaccines that have the original or Wuhan strain in it with an updated or Omicron strain in it as well, so that it just is that better match with the current subvariants. And the newest one, a BA.4/5 bivalent, is now becoming increasingly available. So, we've got great tools, as I say, and it'd just be a shame if we don't use them to their fullest capacity, so that we don't continue to see these trends with mortality and things like our hospitals overrun and more people than we should have being unwell from this virus.
There's still no recommendation for children to get boosters. A lot of the kids who have been vaccinated would have had those vaccinations around a year or so ago now. Are they still covered from those jabs so long ago, or would that protection have worn off by now?
We do know protection wanes over time, and we do know the virus has changed. We call that immune evasion. So, that protection is certainly less than it would have been shortly after those vaccines, but it's not going to have returned to zero. And, we know in the updated recommendations, if children have risk factors that put them at greater risk of severe disease, they may be eligible for a booster. And the best thing to do is have a chat to their GP specialist or pharmacist about their eligibility. Well, children probably don't need a booster at this point in time, but as we've seen with our recommendations throughout, they're very dynamic. They change as evidence comes to light, and of course as the situation changes. So it is something that we do have to keep an eye on, but at the moment most children who don't have additional risk factors probably don't need a booster just yet.
And for adults, are there even better, newer generation vaccines that will be coming out this year?
Yeah, it's been great to see. Obviously, the vaccines that we have been a tremendous advancement in medical and scientific research, perhaps one of the biggest ever. But there's over 200 vaccines that are still in various stages of development with all sorts of additional properties and improvements. So there will be some more vaccines. We'll see some combination vaccines. So maybe in a year or two, you can get a combined flu and COVID. We'll probably see vaccines that don't need a needle and syringe, whether that's intranasal or a patch. There's great work happening in both of those regards. And then vaccines that provide broader protection so we don't need to update them quite as often are also progressing very well. So in the next year or two, we will see some additional vaccines come along. But, right now, of course, the focus is making sure we have a good uptake of the vaccines we already have that, do still work very well.